Different jurisdictions have different, more specific rules suitable for their own jurisdictions.
The first thing Canadians need to remember is it's not over. It is a cautious reopening in certain provinces and certain sectors.
The moment they think something isn't going right, they're going to be readjusting.
Now, Liberal failures cannot be allowed to derail provincial efforts to get our country back on track.
Hi, and welcome to Power and Politics. I'm Vashi Capellos. Provinces begin to reopen their economies today, some more quickly than others, now that the COVID-19 curve is flattening in Canada. In Alberta, Saskatchewan, and PEI, non-urgent medical services can open up today, like dental work, physical therapy, or chiropractic treatment. The same goes in Manitoba, but there you can also visit a museum, get a haircut at a salon, or go for lunch on a restaurant patio, which can operate at 50% capacity. In Ontario, some seasonal businesses are allowed to reopen, like garden centres and landscaping, as well as car washes and auto dealers. Quebec, meanwhile, is allowing any retail store to reopen outside of Montreal. That doesn't include shopping malls, though. New Brunswick eased restrictions last week on social distancing. It's allowing household bubbles when the family in one house can choose one other household to spend time with. People can also go golfing there. Same goes for people living in Alberta and PEI. In BC, Nova Scotia, Newfoundland and Labrador, and the Territories, nothing changes, though. Those jurisdictions have yet to release a plan to lift restrictions. We're going to speak shortly to New Brunswick Premier Blaine Higgs about his province's ability to slow the spread of COVID-19. There are no active cases in New Brunswick right now, and there have been no new cases for more than 2 weeks. First, though, how are the feds making sure provinces are ready and equipped to reopen? Jean-Yves Duclos is president of the Treasury Board. He joins us from the House of Commons foyer. Hi, Minister Duclos. Good to see you again.
Hello, Vashi, and hello, everyone listening.
Provinces, Minister, are beginning to reopen today, as we just spelled out. Many businesses need personal protective equipment in order to be able to do that. Has the federal government assessed how much extra PPE it needs to procure in order to support provinces as they reopen?
Well, we're engaged with provinces and territories on a very large agenda regarding PPE. Obviously, our first priority, certainly in the last few weeks, was to provide adequate PPE to medical frontline workers because we needed to protect them for them to protect us. Now, as we move towards other stages in the crisis, we all understand, and provinces and territories in particular understand, that some PPE will also be needed for some types of additional workers. And the federal government will always be there to help them.
Where are the conversations right now, though? And I ask because, for example, we've heard from dentists who are slated to open their offices this week who are worried they're not going to have enough PPE. Is there a level of PPE that the federal government has figured out it needs to procure in order for example, dentists across the country to reopen?
Well, the primary responsibility and jurisdiction for providing PPE to workers, essential workers in particular, is with provinces and territories. What the federal government does and needs to do is to provide the type of guidelines co-agreed with provinces and territories on where and how that PPE should be provided. We have a national stockpile, which we are using to support provinces and territories, but the actual decisions and guidelines are made by provinces and territories.
Is it time, Minister, for a rethink, I guess, of the way in which that works? And I'm not trying to impede on jurisdiction here, but I cite, for example, the Globe and Mail's reporting last week that Health Canada didn't have a target for the levels of personal protective gear it should maintain in that very stockpile that you referenced, didn't know what level of stockpiles the provinces and territories had, and didn't advise lower-level governments about how much should be stockpiled. How are you rectifying those gaps moving forward in the middle of this pandemic?
Well, we are addressing those gaps, and gaps did exist in the past, and you're quite correct in mentioning that those gaps have to be acknowledged. Now, the situation, fortunately, has improved, is under relative control, and those gaps must be addressed basically by provinces and territories addressing what their needs are, seeing whether they on their own are able to address those gaps, and at all levels work with the federal government to make sure that through international procurement, but increasingly also with domestic production, those gaps can be filled at the time and speed that provinces and territories require.
Aren't you relying, though, on the provinces to isn't it too reliant, I guess, on the provinces? And I ask only because in this instance, with the stockpile in the past, the federal government didn't know what the provinces have. Do you now know exactly what the stock of PPE is right across this country?
Well, we know more, but you're correct in saying that the needs, the knowledge about the needs is mostly with provinces and territories, because they, of course, manage the health sector. They have most of the jurisdiction over the health and safety of most workers in provinces and territories. So that's where the knowledge, that's where the responsibility mostly lie. But this being said, we are in a strong federation with the ability of having a strong central government to procure from outside of the country and also to domestically produce those PPE. And that's why that collaboration, however demanding it is for provinces and territories, is absolutely important.
Minister, as president of the Treasury Board, the financial aid packages your government have levied or have produced are all under your purview as well. Where the wage subsidy program is concerned, does your government plan on extending it?
Well, that's very important that you mentioned that, because may I just mention, by the way, that today, at the very moment, there are about almost 2 million workers that are receiving emergency wage subsidies. Those are 2 million workers who otherwise, in many cases, wouldn't be able to have a wage in today. So they wouldn't be able to put food on the table, for instance. So that program is working well, not only because of the actual help that workers receive, but the actual ability for businesses to keep those workers hired and paid, and therefore preparing for the next steps, where we will need those workers to be ready and fully able to participate in the economic recovery.
When you say, Minister, up to 2 million workers are already benefiting from this, can you be clear about that? Because my understanding was the applications were a week ago. The first money would flow as of May 7th. We're only on May 4th now. Do employers actually have that money already?
Yes, that's right. About 96,000 employers have asked for the emergency wage subsidies. It's a retroactive payment, so it's between the 15th of March and the 11th of April that the first request for payment has been made, and those 96,000 employers cover roughly 1.7 million employees.
But they have the money right now? Already in their bank accounts?
Well, I couldn't tell you precisely about the detailed situation of each of these 96,000 employers or businesses, but they have successfully applied for the wage subsidies, which is great news for almost 2 million workers.
Sorry, I'm just asking because I imagine a lot of business owners are watching right now thinking, oh, wait, I don't know if I have the money yet. Should I have the money yet? My understanding was the money would flow as of May 7th. Is that incorrect?
Well, it's flowing very quickly. I couldn't tell you exactly at which precise hour or day it is being deposited in the bank account of businesses, but we know that 96,000 businesses have applied for the wage subsidies, and that covers about 1.7 million workers. So 1.7 million workers would be receiving emergency wage subsidies, which, as I said, enables the businesses to keep hiring and keep paying those workers.
The subsidy is for up to 3 months, as you mentioned, backdated to March 15th. Will your government extend it?
So we are, of course, following the situation extremely closely. We know there are important benefits of that wage subsidy. We hear all sorts of good stories from businesses. And of course, it's there to help workers. So to help workers in the current situation not only provides them with food on the table, but also an ability to protect their health and the health of their loved ones. So we are going to keep following the situation. And as we've done in the past quite often, we will keep making improvements whenever desired and necessary.
So you have not decided whether or not you'll extend it yet?
No, because it's an ongoing discussion along with many other programs that are going forward.
And I do want to ask about one other program before I let you go, the CERB, and particular comments from Manitoba Premier Brian Pallister last week and Federal Conservative Party leader Andrew Scheer this morning, both contending that the CERB, they are hearing from various employers that the CERB is almost working as a disincentive for people to work. How do you feel about that? What is your reaction to that? And will the government amend the program going forward to sort of, if you do make $1,000, you can still access some, more than $1,000, you can still access some financial aid, maybe not the whole thing, but something that sort of provides some incentive for people to work?
Yes, we will keep making improvements to the CERB and to other programs, but may I remind everyone listening, including Mr. Scheer, that the CERB is paid to 7 million Canadian workers. That's 7 million families who otherwise would have very little to pay, to help, to use to make ends meet. This is a very significant package. If we had 7 million families with no income whatsoever to make ends meet, we would be in a big social problem.
Okay, but just on the point of how the program might later reflect the reality that employers do need employees to come back to work, is there any discussion occurring right now, for example, around the cabinet table or in the federal government, around amending the program once the 4 months is up?
Well, the answer is yes. The two basic objectives of the CERB, which the CERB is handling quite well, is A, to provide food on the table for these millions of families, and B, to help them protect their health and the health of their loved ones when they cannot work, or when they have to stay home to protect their children or their families. Now, as we move forward, we will keep making improvements to the programs and adjust as the situation necessitates.
Okay, I'll leave it there. Thank you very much for your time, Minister. Appreciate it this evening.
Thank you, Vashi. Good night.
I'm going to switch gears now and head over to New Brunswick because that province reported some really positive news today. There are no active cases of COVID-19 there. So what's the secret to the province's success, and does this mean its government will accelerate its reopening plan? Blaine Higgs is the Premier of New Brunswick. He joins us from Fredericton. Hi, Premier Higgs. Good to see you again.
Nice to be here, Vashi.
Premier, I listened to the Chief Medical Health Officer in your province this afternoon present a number of statistics that are obviously really good news. I just really quickly, before I ask you about some of the success your province has seen so far, do want to ask you about the Facebook posts from the airport in Moncton, just saying that they did have one case that passed through the airport in late last month, rather. Any idea if that person is still in New Brunswick, or is there contact tracing going on, that kind of thing? What can you tell us?
Well, I can't speak to that particular case, but yes, we have lots of contact tracing going on. So if there had been a confirmed case, then it would be tracked, and we would know where they are and be counting down the 14 days.
So on the success then that your province has seen so far, and I should be explicit, and we did name some of the items already, but for example, all the cases are recovered, no deaths. This is the 18th day, correct me if I'm wrong, that there's no new cases in your province as well. What do you attribute to that?
Well, I think we're day 16, and it's good news, and we're certainly glad to see that trend continuing. Well, I think it was early on. We got into the game early, and I give a lot of credit to our Minister of Education, who was a world traveler and spent a lot of time in third world countries and saw infectious diseases wipe out a colony. And basically saw this happening in China early on. We had students that were in Italy that were on tour. That was during the March break. When it was just started in Italy, we didn't bring them back. We said, you're not coming into school for 14 days. And that led to school closures. And then we went to so on. We kept just moving quickly to close borders and close businesses. And so I think that rapid reaction initiated by the initial concerns that our minister brought forward, it got us in the game early. But having said all that, we know how quickly that could change. And that's why we're monitoring borders very, very closely as we start to ramp up. And obviously, with 16 days of no new cases and all our cases now recovered, people are getting antsy in the province to kind of get moving and see the new norm start up and get on with it.
Yeah, I want to ask you about that. When you look at 16 days, rather, you're right, not 18, of no new cases, does that change the assessment for your phased plan for reopening the economy? For example, could it advance the speed at which that next phase kicks off?
Yes, it does. I mean, in reality, and there's been a lot of meetings held over the last few days in relation to what could we move forward that was in phase 3, move into phase 2. As you know, our time frames are like 2 to 4 weeks, and this will be 2 weeks this Friday. And we had a criteria that if we saw 3 cases that were totally unrelated, community cases in 6 days, that would be a point of concern that we wanted to nail down before we move on. Well, we haven't seen any of that. And we have done a lot of testing. We completely opened up the testing criteria. I mean, if you wake up with a headache, you can be tested. And so it's like, but we're still so far so good. So we are moving forward. I will be bringing out the plan on this week, Thursday, Friday, likely, but certainly this week, to allow us to get back into more of a norm as we start to get our economy up and moving again.
When you talk about reopening the economy, other provinces, and specifically the private sector in those provinces, have come forward to voice some concern about the level of PPE that they're going to need to feel safe opening and for people to feel safe coming into their businesses. Do you have any concern on the part of your province about the ability to acquire the necessary amounts of PPE?
Well, sure, it is a concern. Now we have you know, an adequate supply here because we haven't seen the demand in our hospitals and in our other areas. Although we're using certainly all the protective gear with our healthcare professionals and in every area that we're having close proximity with one another, we're following all the rules of public health. But it hasn't been quite the same as we've seen in other areas. And, you know, a lot of that, of course, is the diligence that we've seen from our professionals from every category. And I use the term professional from every sector of people involved here. But also in relation to, you know, we have a little different demographic in terms of spacing and such in our province. It allows us to start moving into a different zone quicker because we aren't as congested as some of the big cities in other areas. We have our urban centers, but they're not like a Toronto or Montreal or as such.
And when you talk about borders, and your Chief Medical Health Officer talked about borders as well, and the significance of sort of the comparison almost of the cases in Europe or the lack thereof in your province versus other provinces, what does the border situation look like for you in the coming months?
So I look for the borders to stay certainly very tight, and we'll continue our border compliance and stopping cars, understanding where people are going. You know, we're a province that connects other provinces, so people are coming through New Brunswick, but we're tracking them to know that they're actually going through or they're stopping for a reason because they're going home, they live here. Or it's a service being provided that is part of an essential operation. And we have some construction going on as well that we have to be cognizant of. But I've asked for actually a detailed breakdown of all of the traffic moving in and out, categorizing it so that we can be cognizant. You know, we get complaints, and I had one today in the news conference about someone who got stopped and was being asked more questions about where they were going and why. And you know, I just commend our border, you know, security team because it might be an irritant, but it's an irritant that's going to allow us to open up in a broader way here in New Brunswick, and our biggest risk will be in relation to borders, and because all around us right now we have concerns about the different levels of the COVID and the virus in different provinces or states.
In a tangible way, though, does that mean that the restrictions that are in place right now last for another few months, or is that something at least another?
Yes, I would say in a few months at the very least, yes. At
the very least. And before I let you go, we are hearing, for example, from Manitoba Premier Brian Pallister, as well as the leader of the official opposition at the federal level, and this is something that we spoke with the federal minister about as well, but around the CERB and various financial aid packages being offered, or some financial aid being offered by the federal government. Premier Pallister, for example, was voicing concern that Canadians are disincentivized from going back to work because of the CERB. Have you heard that at all? Do you share in those concerns?
Yes, I certainly have heard that, and it is a concern. And I know I've made an appeal here because I need people in the province to look beyond the 4 months, you know, which is the CERB is only there for that period of time. So we're looking beyond all of this for rebuilding New Brunswick. So it was with my issue with the temporary foreign workers. It was let's use New Brunswick people to help the farmers and the processors, and let's keep our borders safe. Let's minimize you know, people coming in for reasons that we may be able to mitigate. So yeah, it is an issue. It's real.
What do you think the federal government should do? And I asked because the Prime Minister was asked about it today, and he said, we're not there yet. Like, the pain is still acute in other provinces. The need for the CERB is there in the country, is what he was saying. The opposition, the Conservatives, for example, are saying, well, figure out a way later on to maybe phase it so that, you know, if someone's making more than $1,000, they can still receive some help, but just not as much. What do you think?
Well, I think there has to always be an incentive that encourages people to return to the workforce. And so while having it phased or having an approach is part of it, but of course, in how it's treated, if someone goes to work, do they lose it all, or is there a mechanism there that allows people to say, well, I can go and I can earn money along with this? But I think it was put in for noble intentions. But, you know, sometimes consequences come in different, trying to help one thing, it creates a problem in another. And that's what we have here. So I think it's a case of saying, look, we have to rebuild our economy. We have to have people thinking beyond 4 months. If the federal government keeps, laying out, well, I'll be there 4 months and 4 months and 4 months, then people think, well, I'll just wait for the federal government to provide the service. I am pleased with the level of activity the federal government has provided and continue to, but we have to focus on what's going to be the end result. If we don't understand the repercussions down the road, we're going to be left with what happened, and our economy will be in worse shape. So it's a rebuilding, and it's not just a matter of how much money can I throw at this in order to survive the next few months. I'm looking at the next generation.
I imagine also people who are concerned about sort of the safety of going back to work, are also, it's not just about not wanting to work. They're probably concerned also about their own safety.
They are, and that's legitimate. And it's the case so that every employer has an obligation to meet the public health standards. And every employee has the right to challenge that and then work safe. Our group will audit that. And then should it be determined that it's safe to work, then that's fine. The employee has an obligation to return to work. And if it's not safe, the employer has an obligation to fix it. So there can't be an excuse that's unknown. If it's real, it'll be fixed because it needs to be a safe working environment.
Before I let you go, Premier, every time I speak with the Premier since Friday, I'm surveying, trying to find out what the level of support for the federal government's ban on assault-style weapons is. They announced it on Friday. Are you supportive of what they introduced?
Well, Vashi, I'm supportive of finding a solution here to the handgun, or not handgun, any guns, and the violence that we've seen in say crimes related to gun violence. It has to be addressed. We have to find a solution. Whether this is a solution or there's something more or different needed, I don't know, but we all have one clear focus, and that's less end handgun violence, less end gun violence of any kind. It's going to be a major concern for all of us, and it is already.
In principle, do you support the action that they took, though, to ban that list of assault-style weapons?
Well, I don't know in terms of the list and what it entails. I guess my point is, years ago, there was a registry put in place, and I'd like to look at the stats and say, how much did that change the conditions around gun violence? Because let's find actions that really work. And to comment on the list and go through each gun, I'm not anyone that knows a great deal about guns, so I can't comment specifically. The target is noble, and if we're all focused on the same thing, surely we can find a solution together.
Okay, Premier Higgs, I'll leave it there. Thanks for your time this evening.
You're very welcome.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.